The Supreme Court has been reviewing the Affordable Care Act, which will affect the health care plans of all U.S. citizens, and it's clear to see that this is a landmark case. The question is the act, or at least some of its main components, easy enough for the average young citizen to understand?
Universal health care, well, I don't really know that much about it, so I don't really want to say an opinion.
I really don't know any of the details.
I think it is hard to understand until you get into it.
It's almost as if I'd gone out of my way to go and learn about it.
We asked Richard Essenberg, the president of the Wisconsin Institute for Law and Liberty, whether the fact that the Affordable Care Act is hard to understand might be a problem if it is fully implemented. Here's what he had to say.
Well, I think it's impossible for people to understand. Everybody laughed when Nancy Pelosi said that we should pass the act so that we can see what's in the act. And that was funny because normally you would expect legislators to know what's in a bill that they're about to pass. But of course, none of them did and none of them could have because the thing is thousands of pages. But the truth of the matter is that even if you read the bill before it was passed, you still wouldn't know what it's actually going to do because a huge part of the Affordable Care Act actually sort of delegates decision-making to numerous agencies and boards and commissions, some of which exist, some of which are created in order to decide how it is that the thing will be implemented.
So, what are some of the aspects of the Affordable Health Care Act that are clear? Here's a few.
Insurance companies will no longer be able to drop people's coverage when they get sick. Tens of thousands of uninsured Americans with pre-existing conditions, the parents of children who have a pre-existing condition, will finally be able to purchase the coverage they need. All new insurance plans will be required to offer free preventive care. Young adults will be able to stay on their parents' policies until they are 26 years old. Seniors who fall in the coverage gap known as the donut hole will start getting some help. They'll receive $250 to help pay for prescriptions, and that will, over time, fill in the donut hole. Americans on Medicare will receive free preventive care without co-payments or deductibles.
For the Milwaukee Journal-Sentinel, I'm Nushmia Khan.